Talk about 2 tips to help you during your intake sessions with parents and caregivers. So, the first tip comes from understanding that the brain really likes and appreciates knowing what's going to happen next. In synergetic play therapy, we talk about it as making the unknown known. So, we're going to offer this up in our intakes, making the unknown known for the parents and the caregivers. And this shows up in 2 ways. The first is in the intake itself. So, parents and caregivers are coming to meet with us and they've never been there before. They don't know what to expect. Some have maybe never even been in a counseling process before, and so they really don't know what to expect. So, one of the things that we can do right from the beginning that helps their brain out a little bit, helps them feel a little bit more safe in the relationship with us, is to go ahead and make the unknown known relating to how the time is going to be spent in the intake session. So, you could begin the session by welcoming them and then offering up a possibility of how you could spend your time together. So you could say something like, here's how I would like to propose our time together goes. We could do this, we could do this, we could do this. Would that work for you? And what you're doing is you're outlining for them the flow of what you're going to cover during the time that you're with them in the intake process. This helps their brains go, okay, I know that we're going to get there, or I know that we're going to eventually cover this, versus them just sitting there going, I don't know what I'm supposed to talk about, or when are we going to get to this, or are we even going to cover this in our time together? So that's the first place that we can make the unknown known. Go ahead and outline for them what you're going to be doing together during your intake process. The second part of that is that they also want to have an understanding of what's going to happen with their child during their play therapy journey. So, however, this works for you in the modality that you have been trained in the way that you go about teaching and talking about what you offer and how you provide your service, it's important to be able to really share that with parents and caregivers. Explain the journey that their child would go on, explain how they would be participating in it or not. Help them understand if they were to say, yes, let's sign up, let's do this, or maybe sometimes they're not even being able to agree, but they're forced into the process. Either way, they deserve to know what is coming next. So, how can you make the unknown known a bit more so they have a deeper and more broad understanding of the process and the journey that their child and thus they are about to go through if they work with you? The next tip has to do with understanding that when the parent and caregiver come in to see us during the intake process, that they are already struggling. They're already having a hard time because there's been a challenge that's been going on of some kind. And it's an incredibly vulnerable experience to be able to go in and meet with someone and basically say, here, I can't help my child. I need you to help my child. Or I've been told that I have to come and see you. Otherwise, something, my child can't be in the school or whatever it is. It's an incredibly vulnerable experience for parents and caregivers, which means that as they're talking about what's going on or as they're engaging in the intake with you, the probability of some dysregulation arising is pretty high. For some parents, it's really big. You may experience a lot of anxiety. You may be with them and you're noticing that there's a lot of activation. Maybe they're really withdrawn, but there's some dysregulation that is arising on some level. Maybe it's not extreme, but you're still noticing that, again, even in that vulnerability, that there's some dysregulation in the vulnerability. And when this arises for the parents and caregivers, they need to be able to borrow your nervous system. What do I mean by that when I say that? They need to be able to borrow the part of you that's connected to yourself. They need to be able to borrow your presence. They need to be able to borrow the part of you that's able to be poised, even though you're going to be feeling all of this as well because you're in relationship with them. They are, in a sense, borrowing your regulatory capacity. So the tip in that is for you, as you are in relationship with them, as you notice your own dysregulation, can you take a breath? Can you ground yourself? Can you connect to yourself a little bit more? Because it's important that they're able to access you and borrow that regulatory centered place inside of you, which does not mean acting calm or anything like that. It just means being connected to yourself. Are you able to offer them that? Because I guarantee that the combination of that and helping make the unknown known help their brains go, which allows them to be able to actually have more conversation that's driven from their prefrontal cortex, to be able to engage with you, to be able to get off on the right foot, so to speak, so that you're on the same page and that there is a sense of connection and a sense of safety that's already occurring within themselves and in the relationship with you. So next time that you have your intake, take those two tips in mind into the playroom with you. You are the external regulator and help make the unknown known.